Now I am pleased to introduce Ginger Feldman. Ginger serves as the Corporate Relations Director of Local, Regional, and National Partnerships for the American Cancer Society, where she works with mission-driven companies to create strategic solutions-oriented and 360-degree partnerships that deliver long-term impact, both for businesses and for cancer patients. Based in West Michigan, Ginger leads efforts that drive brand value, employee engagement, and community goodwill through purpose-filled collaboration. With over 25 years of experience spanning nonprofit leadership and corporate sales, including senior roles with the March of Dimes, Boehringer,
Ingelheim.
Ingelheim Pharmaceuticals, thank you. And now the American Cancer Society. Ginger brings a powerful blend of relationship management, fundraising, innovation, and marketing strategy to her work. She is known for her ability to inspire companies to align their causes with consumers and employees care about, resulting in greater brand recognition, loyalty, and impact. She has received numerous accolades, including the March of Dime Leadership Awards, 2015 National Working Mother of the Year, and multiple EPIC Award nominations from the Grand Rapids Chamber of Commerce, and more. So with that, please welcome Ginger, and her session is Partnering with Purpose, How HR Can Leverage Charity Partners to Achieve 360-Degree Impact.
Thank you. I'm so glad you all woke up after the party and are able to be here today for this session. And I know that you're all truly committed because it's Friday morning at 9 a.m., right? And we're all here to do this. I want to hit start. You did a great job of introducing me, thank you. I have had a lot of experience in both corporate, for-profit, nonprofit, and then also run boards, leadership teams, all sorts of things. And really in the last 10 years of my work, it's really been focused on corporate relationships. And so we're going to talk a little bit about that today. And what I was really excited to talk to you guys about is in my conversations with corporations, a lot of time the entry point is the HR department where I'm being funneled to chat with you guys. And I'm ending up on your doorstep along with 300 other nonprofit representatives. And then I feel like there's a lot of tools in our belt that aren't necessarily being used by the organizations. And so I wanted to make sure that I could move beyond transactional relationships and we can move into more of a meaningful relationship, a purposeful relationship with the organization. So that's kind of what we're going to focus on today. This is our quick view of the agenda topics. I have a couple of facts, so I will refer to this occasionally to keep me on track. We will have a couple of interactive moments and then a Q&A at the end. So I want to level set a little bit on the nonprofit perspective of the HR manager. Yes, we know you're the gatekeeper. Yes, we know we're going to land on your doorstep. Sometimes this is not a job that you want to do. Oh, I will shout out the poll that I put out for the session. And I'm going to say there's only 5 truly honest people that filled out our poll for us. There was a question of how do you view your charity partners? And some people were like, it's the greatest thing ever. It's my favorite part of my job. I get to improve employee relations. And then 5 people were like, it's a headache. I'm the gatekeeper. And I know that that is out there and that is a true thing. But it's probably not you guys because y'all showed up to listen to me. So thank you for doing that. So I'm still saying 5 honest people out there filled out our poll. But you guys are really and truly the central cog to everything that happens within an organization in terms of making impact on the employees, the culture, like we were just mentioning a few minutes ago, in terms of sales and marketing, leadership, how the company is perceived in the community. And then using that, you guys can have so much impact on your community and ultimately the global good. So I do currently work for American Cancer Society. So some of what I talk about is going to come from the cancer lens. And we'll talk through some of that. So I did want to define what is 360 impact because I know in the HR world it is a performance evaluation, and maybe that wasn't the term I should have gone with, but it is a term we use within American Cancer Society. And so in our world, you all are the center hub of all of these things that I mean, there's many more things, but these are just a few that come to mind. Things that you can impact in terms of your, within the company, the areas of impact and areas of growth. So engagement and morale. So if you partner with a good charity, a properly managed charity that is supporting you, and you all unite against a cause, that actually will build morale. If you all show up in matching t-shirts on a Saturday and you cook up some hot dogs, that actually creates morale. What I like to think about is the companies that have had trouble internally, externally. Is there a way that they could join with a strategic partner to counteract the public narrative that's being told? So like, I'm thinking Wolverine, I'm going to use Wolverine as the example. They had the PFAS situation in Rockford, and a lot of people were having health experiences. Is there a way they could partner with a charity like ACS or someone else and address that to change the public narrative about what's going on out there? Skill development. Had lunch with another HR manager yesterday, and he was sharing with me, I was sharing with him how the employees can actually have skills developed. So if you have a leadership training class or folks that you've like looked at to move up within the organization, can we as a charity partner have them serve in a leadership position, an executive leadership team, a committee, a project? So we're also coaching them to be a good committee member, have emotional intelligence, and like show their leadership skills, develop that muscle, and then they're gonna go back and teach that within the organization. Just something maybe you don't think about. We're gonna dance now. We're having a dance party back there. Health and well-being obviously makes sense, like with organizations that are concerned with health, American Heart, American Diabetes, like all these ones, we are working and we have a plethora of materials to help you guys carry off the messaging, health and wellness challenges, walking challenges. I have a stable of information that can hit your inbox every month that will give you talking points, newsletter articles, posters to encourage screenings and like activities. So there's just a lot going on in this world. Let's talk business outcomes. So marketing and sales. So if we're co-branding a product with you, if we're doing a logo placement with a product, running a campaign publicly. I just like invented a campaign for a communications company where we were talking about telemedicine. They're a software company that like connects doctors to their appointments. And I was like, what a great thing to talk about. This is like the work that we're doing. Can we wrap this all together into a larger piece, a larger conversation? So we'll get into reducing insurance costs on the next slide. Reputation, trust, values and actions, and belonging. All of these things are areas that I feel like aren't always considered when you're looking at a charity partner. And I would love today to just break that out of the mold of a transactional relationship. I'm going to give you 3 facts. So Benevity's engagement study found that employees who actively engage in giving and volunteering are 57% less likely to leave their jobs, leading to better retention and reduced recruitment costs. The Gallup meta-analysis of 1.4 million employees revealed that organizations with high employee engagement and experience have a 22% increase in productivity. Bottom line, right? Can we increase the bottom line? Deloitte's Volunteer Impact Survey found that 87% of employees consider volunteer opportunities a factor in their decision to stay with an employer. So ultimately, we just want to help you guys as the HR professionals hit your goals, hit the CSR goals, hit the sales goals, hit the entire organization's goals. And if we're clear about what those are, we can help you get there. So we're going to stop for a minute. We're going to go on my ACS hat, my American Cancer Society hat. We're going to talk about the benefits and costs because cancer is the top 3 driver of benefits costs. Is that the case? Yes? For health benefit costs. 1 in 2 of your employees are going to have a cancer journey while they're employed with you, if they're under 50. We're seeing a rise in diagnosis of under 50-year-olds, which is scary. Recently, I was in a discussion with a Fortune 500 HR manager, and he was sharing with me that they had a pediatric cancer patient that had a $2 million claim. Nightmare stuff, right? His insurance costs were increasing by 50% for 2026. And so this cost is what we're trying to mitigate. There aren't a ton of things out there that are really looking to mitigate the cancer costs. Whirlpool actually shared with me at one point that they had $13 million in cancer costs for 1 year. They were self-funded, and they were asking me to help them increase their screening rates and reduce their cancer rates overall. I think we all know that if we catch it earlier, it's easier to treat. You move back into work faster. It is incredibly important. So my question is, if you partner with a health charity on a specific disease diagnosis, would you be able to move the needle? Can we provide you resources that is going to help you reduce the cost overall and encourage your employees to take care of those modifiable risk factors? Absenteeism among workers with cancer, 69% miss more than 4 weeks of work, and 39% miss more than 3 months of work. I'm a survivor. I was diagnosed in 2014 with breast cancer, 10 years, cancer-free, yay. Yay, here's a little clap. And in that time, I had a really flexible schedule. I was so thankful for my employer at the time, and they let me work from home, and this was pre-COVID, so it wasn't really a thing back then. And they let me work from home on certain days, and then I used a PTO day at the end. And I was able to continue to work through it, and it was such a brain break. It was a relief for me to be able to go to work and talk about something that wasn't cancer and wasn't all encompassing, and really focus on the business at hand. So the last piece I just want to reference here is 45% of those modifiable risk factors. So 45% of the incidence of cancer, because everyone comes to me and goes, what do I do to not get cancer? We're American Cancer Society, right? 45% of those risks are actually modifiable. So we're talking diet, exercise, smoking, all of the screenings, all of those things are going to help mitigate that risk. So I just wanted to give you a little bit of our perspective, or the nonprofit perspective, of why you guys as corporations are so important to our world. You provide a steady stream of leadership. You provide a steady stream of revenue, hopefully, a steady stream of volunteers, a steady stream where we can carry out the mission in the population of the workforce. You also help us extend our reach. So if you are a headlining person, sponsor on an event, and we get to use your logo and shout from the rooftops that you're there, we love that, because other people will be like, oh, I didn't know they were involved, and I know them, and it does kind of lend a pile-on effect. So those are some of the reasons why it is so important to have corporate partners, and that's why I wanted to partly be here today. Okay, so Giving USA released this report on national giving. This is not just Michigan, this is national giving, released in 2024. You can see that there's individuals, corporations, bequests, and foundations. You guys touch, as an HR professional, you touch corporation giving, individual giving, and foundations. You can influence 92% of the giving that's happening out there nationwide. That's huge. And if you guys have a law benefit plug-in where they're doing planned giving or will writing, you could also hit 100% with the bequests. So that's a lot of influence. This one I just wanted to share with you to show that it has continued to increase. I know we're in some unstable times. It feels a little unstable as a fundraiser. But our giving overall has continued to rise. Corporate giving, foundation giving, and individual giving have all increased. This is as of 2024. They have all continued to rise. And again, I just wanted to say, this state, our area is so giving. It's truly built into the bottom line of what we do as corporations, and I hope that you guys feel that as well. That's what I see. And so I just wanted to encourage you. Giving is increasing. We are seeing support. Obviously, we always need more, but sorry. I want to take a second, and actually you can do the handout now. Is that okay? We're going to talk for a minute about choosing your partner. I know a lot of you have already chosen your partners, and you probably already have like a stable of charities that you're working with, but I just wanted to kind of level set and give you some of the recommendations that I've seen work in different corporations. I think the top thing, okay, we're not going to use names, but I met with a major foundation here in West Michigan, and I came to find out that they did not know or have a vision or mission for their work. They didn't have any idea. They would just give money to the coolest, brightest, shiniest cause, and I thought, oh, you could do so much more if you would focus your vision on a specific target, a specific need area, and really move forward with that. Invest the money in a vision, in a particular pillar or a particular vision. So I wished that they would have surveyed their employees, and so that's like if you get one thing, survey your employees. That's my big thing. A lot of you guys will already have a defined mission, but if you don't, I recommend that you get it narrow, figure it out. What aligns with the company? So Farmers Insurance switched over to Red Cross because it aligned with their vision and what they were doing for work. That's great. What a great partner. That makes so much sense. What a great story to tell, right, publicly? What challenges are you facing? We talked about the Wolverine Challenge. Is there ways that you can lean in on things that maybe have been sticking points in the community, and you can just kind of polish those up a little bit through a really good and strategic partnership? I love American Cancer because we are all over the nation. So I often encounter businesses that have many locations, and how do they fit the needs for far away locations? We've got that, right? We can do that. So does the charity fit your footprint? I love the idea of taking some of the load off of you guys. Let's take the load off of HR. Let's plug in our ERGs, our resource groups, our women in leadership. Is there a group that can really take the lead and take charge with what's going on? And then I guess lastly, also check with your leadership. What are they engaged in? Are they serving on boards? Are they giving of their own money or the company's money personally? Is there areas that are just going to make sense for you guys to lean in? I was talking to Walmart, and Walmart chooses their charity partners a couple of different ways, but one of the charity partners is chosen for employee retention. They call it an employee retention partner. And I kind of think of it as a passion partner, right? It's who the heart of the employees are with, and who, it may not make sense, super tons of sense for Walmart to be aligned with this incredibly, maybe not aligned, just doesn't make a lot of sense, but it is something that the employees are passionate about, and so they stick with that partnership. So there's different reasons to choose a good partner. Okay, the Morning Consult recently released their most trusted nonprofits. I'm giving you a couple of flyers to take home with you because I am American Cancer. You have to take a few home with you. The most trusted nonprofit report came out. I do think as you're choosing those partners, it's important to consider the public relations, the vision of the organization and how it is perceived publicly. If you're going to slap a logo on your product, you want to make sure that they're going to be a good partner for you. They are trusted, they are viewed positively. These are just the national ones. Obviously, there's many grassroots and local partnerships that are also important. So just being aware of what's happening out there in the news and what's happening within the organizations and the work that they're doing. Okay, let's talk cause partnerships or product placement, logo placement, cause marketing for a second. American Cancer has a couple of things and has done some research. You'll like my bananas. We'll talk about those in a second. But brand awareness. So when someone partners with American Cancer, 94% of the people recognize American Cancer as a brand differentiator, that we are doing good work. And so it's a great trusted brand. And that's like what we were talking about in the last slide, like choosing a trusted brand to be a part of. The center column here are some statistics about general cause marketing. People will choose to pay an extra dollar if they know it's a good partnership. People will, 60% reported knowing which nonprofit and how their donation would be used is important. So part of my work as a good charity partner is making sure your people have talking points, they have information on what the work is that we're doing so that they can speak versedly at the register, in the break room, that they understand why we have undertaken this partner. Do you like my bananas? So it's October, it's Breast Cancer Month. And right now, all of our bananas are partnered up with our Pink Ribbons campaigns. So the bananas have gone pink. And that is one of our longstanding national partnerships. So I just stuck them up there because they're funny. All right, different types of partnerships. So again, trying to break out of the sponsorship. Yes, I will take your check. Of course I will take your check. But let's go beyond just events. Like, let's make it a little bit more useful, a little more meaningful for both the employees and the company. So these are just some of the ones that I get to be creative around, and we do many more than this. But cause partnerships, event-based, advocacy. So I have some of my corporate partners that are very interested in what policies are being changed, either Michigan or federally, and they'll make a partnership with us to help align our values and make sure that we're advocating for what they need to happen nationally so they can continue to do business. There are so many different ways. In-kind workplace giving, so your payroll deduction, that's the easiest way to like partner. Have folks elect, give $1 every paycheck. Matching gift. A lot of HR and wonderful companies will do the giving. Like if someone volunteers for the organization, they'll either pay the employee or pay the corporation or the nonprofit. Point of sale, so your register roundups, that does come to us. I know there's like a big myth out there that those don't actually go to the charities. They absolutely do. We have contracts and lawyers that make sure all that gets taken care of. And then volunteerism and employee giving and engaging. I'm going to give you a couple of specific examples of some companies that have really leaned in on this total impact concept. So Cascade Engineering, this is one of my accounts here in West Michigan. You may or may not have noticed the big trash cans in your community, and if you haven't, now you will, because I have mentioned them. So in a couple of years ago, about a decade ago, Joanne Perkins was a breast cancer survivor, and she came forward and she worked in this, making the carts, the trash carts. I call them Herbie Kirby's, but they call them carts. And she partnered with American Cancer at that time to put the ribbon on it, and then on the top it actually has screening guidelines. So it does have some actual mission and screening guidelines information on the top of the can. They have actually now raised almost $750,000 for American Cancer. They built into the platform, there's like a give back, a $5 give back. If someone purchases one, they are sold through your individual hauler. So you go to your West Michigan Trash or Granger, and they can get you a pink trash can. The company is here. They do event support, so their employees are walking. We're seeing employee engagement. We do health and wellness fairs, health and wellness events, talks about like the services that ACS can provide with the organization. And so I love that this really hits their core values. They have a core value of the triple bottom line. Fred Keller wrote a book about it a couple years ago, and it's community, employees, and company, and that's how they measure their success in CSR land. And for them, they're hitting many areas through one really well-structured partnership with American Cancer. This one is Ashley Furniture City in Florida. Has anybody been there? I mean, we all know Ashley Furniture, right? So this one is really interesting. They've done a lot to drive business into their stores. So they started out on the second point there with the test rest. So they did an 8-minute test rest. If someone comes in and tries out their mattress for 8 minutes, they make a donation to American Cancer, and they also give a gift card back to the customer. So in that way, they're driving business into the stores and hopefully selling more things. That's ultimately the plan. They do pink pumpkin partners. That's hard to say at 9 o'clock in the morning. But they use their vendors, the other people that they work with in their environment, in their community, and they have raised another $115,000 through partnerships and sponsorship and things like that that's happening for this Pink Pumpkin campaign. And I just love the visible, right? How visible, in marketing is going to love this, right? We're going to be like, yep, we got you, marketing. We'll give you content for days. So they also do, their employees are engaged with Making Strides, and then some mission investment in the Getting Screened campaign. So they're utilizing the full gamut of the things that a charity could offer in this case. This one, so Sleep Number, this one's a national partnership. This is pretty amazing what they've done here. So we have leadership engagement. Their top leaders are serving on our boards and our roundtables. So they're in the rooms where decisions are being made, and as high a level as we can touch and get them in front of the right people to continue their growth. They do Fit to Be, which is a health and wellness step challenge that American Cancer has. So all their employees, wherever they are, take part in our Fit to Be challenge. They cook up hope at the Hope Lodges. So one of the other programs that we have over 31 different lodges around the world, or US, that patients can go and stay at during a cancer treatment time. And they go there and do cooking lessons and cook for the patients that are there. The part that I think is super interesting in this particular partnership is they are actually funding their marketing for the next 10 years. So they joined with American Cancer in a multi-level research project on sleep's impact on cancer. Can you imagine what kind of claims and statements could come out of that? So they're actually investing in what they're going to say in the next phase. I think that's so brilliant, right? So brilliant. On top of that, they happen to also be giving us all the mattresses for our Hope Lodges. So our patients are they're staying in the lodges, and they're sleeping on some Sleep Number mattresses, which is just all heart, right? So much heart in that story. Okay, so you passed out the growing partnership. On the back is some circles and some mapping. And I would just love to, I was going to take about 8 minutes or however long we need. Love for you guys to map out either a current partner or a dream partner and kind of put that in the middle, and then map out the ways that you currently engage, and maybe there's some dream ways. And we're going to set aside barriers. I love to dream big vision. So we're going to dream big vision, no barriers. We're going there next, but go ahead and fill that in, and then I'd love to have one or two of you share about that at the end. Thanks. You said this is on, right? This one's on. Yeah. We'll come back together. Is anybody want to share their either great partnership they have or some ideas for a future partnership? Yeah, come on. Do you want a mic? I don't know.
I can talk pretty loud.
You're doing good. I feel like, yeah, go ahead.
So we work for lumbermen locally, and part of our mission is to be involved in our community. So I think we've done a really good job at finding local partnerships,
Yeah.
specifically in the Grand Rapids area. But we're growing, and so we recently opened a location out in Minnesota.
Right.
So figuring out how to find bigger, larger, nationally scaled organizations to help leverage that across the company in all of our locations. So something like Habitat for
Yep.
Humanity, we can be really fun.
That'd be amazing. Yeah. Yeah, great example. Great example. Have you done much with Habitat already?
I know we have done a little, we're more, we do a lot with like the smaller community partners in the area.
Sure, sure. I'm sure they have them in Minnesota as well. Anyone else? Another great example? Yeah, go ahead.
Our company has a lot of kind of real entry-level hirings, a lot of folks that don't speak English.
Yes.
And
Okay.
aren't paid a lot, right? So I kind of had kind of two different areas, but also one is from just an insurance point of view. It seems like our biggest cost driver last year was more diabetes.
Okay,
Actually.
great, yeah.
That was kind of one avenue, but it happened to be like maybe thinking out loud, just, screenings with multicultural type emphasis where people can come and speak different languages.
Yes,
So maybe like the local, like Cherry Street or something like that.
love it, yeah.
And then on a broader sense, again, thinking about the population here to serve, so, we probably wouldn't do as much volunteer stuff with a lot of our employees that are fairly entry level, so it doesn't make sense. They probably need volunteer work themselves.
Yeah, they do, yeah.
Than anybody else. But again, probably partnering with people that would be more focused on, immigration language services, so ESL, type of things, or, how to, whether it's, legal services, issues like that, so maybe something like Samaritas or Bethany Christian.
Yeah, or like a Hispanic chamber or something like that too.
But it's all different, like,
Oh, yeah, many languages, yeah. That's fun because we actually do have our helpline and they do it in over 200 different languages. You know what I mean? Yeah, so we have a fair, if you get with like American Diabetes, I'm sure they have a mountain of stuff that's like ready to go. So, anyone else? Did you want to? Yeah, go for it.
So up in northern Michigan.
Yes.
Grand Traverse Resort, we partner, Special Olympics.
Yes.
Which is really cool to see every February, over 2,000 athletes.
So good, yeah.
Come in, which is great. And then in my line of work, I work, with the international H2J1s, visa holders.
Oh,
and
yeah.
we don't offer, health insurance
Oh.
for those individuals that come in. The J1s tend to get them through the agencies that they work with, part of, the program that they work with.
Yeah.
The H2 employees that come in, they're here for 8 months, and they don't get health benefits through the resort.
Ugh,
Right,
yeah,
because of the costs associated with getting 100 of them,
Right.
out during our peak season. So, kind of opening that branch to.
yeah.
I've been working, I've been kind of researching, looking at, mobile buses coming in,
Yep,
from time to time, but, obviously, I need to get a buy-in from
the community. Yeah, exactly.
people that I report to.
Yeah, I love that. I love the way you're thinking about what the employees need and support, what your visa holders need. I love that. I love how just being mindful and then even expansion, like what does that footprint look like as an organization and how can we, as the charitable side of the world, like help support that? Like ultimately, that's great. Thank you. Thank you all for sharing. Just a recap, it's on your flyer of just some of the areas that I feel like make a lot of sense. And thank you. So, okay, it all doesn't happen in a vacuum. I get this. Like, there are so many challenges to implementing things and programs and pieces that are going to be done inside of an organization. I listed a few there. If you guys, please shout out like what I've missed, because I know that you didn't get them all. I hear lack of buy-in, like more than anything. And we'll talk about how to overcome some of those in a minute. But getting the employee groups interested, I think it's interesting when you talk about a younger population. Like, where are they in their career, right? Like, what are they needing to be supported? Time. Everybody says, I don't have time. I have time. Yeah. It's funny because I've been doing this for a lot of years. And in the beginning, everybody was like, I can't give you money, but I'll give you time. And now they're all like, we can't give you money or time. So neither is happening. Staff turnover at both the charity and the company, right? You start this relationship and then suddenly your person is gone or the person that was leading the charge is missing. I will admit sometimes the charity's bandwidth is thin, right? We're cut tight. We don't have a lot of staff. Even, I know I'm American Cancer, but we still don't have a lot of staff to like carry off these larger scale projects sometimes. I would say lack of leadership buy-in too, like having the leadership step up to the plate and like share the vision of where they're headed and what they want to accomplish. Anything else?
Self-image just awareness of what do these organizations do.
Yes.
There's a lot of others. That's something.
Awareness. I'm thinking language for you guys too, like all the multiple languages. You're having short-term employees, right? So like, how do you engage them quickly, and then they're going to move on in an 8-month stint?
Luckily for us, we have a lot of return.
That's great. So I will share that, like in my experience, some of the ways that I try to mitigate some of those risk factors and challenges is really going to be executive leadership. So it goes back to the surveying of the employees, surveying of the leadership teams, understanding what the vision is. If you can get the CEO, even if they don't have a lot of time to like invest, if they can write a email and support, and frankly, your nonprofit charity partner will script that out for you, so you don't have to do all that work. Maybe a video of them, like saying why they care about this and what the company's going to do. That will go a long way. I love identifying an internal champion. So if you have somebody that has had an experience with the charity or the ESL or whatever the case is, using them as an example and like telling that story, it rallies people. We're so good at storytelling. So I work on the Engage for Good, which is a CSR and nonprofit organization nationwide. And they brought up 2 things that I think were really interesting. I hadn't thought about them before. Build an advisory committee around how to impact a specific issue. So like if you had a language issue, like how you could build a advisory team around how to affect that issue, and regardless of what charities or whomever is involved, and you're just focusing on like how do we impact this one issue and move it for our organization. I thought that was really interesting. I would love to have you guys think about how you can position yourselves as a value add to all the other markets in the room, all the other business functions that are happening in your organization. So marketing, sales, there are many ways that you're going to be able to assist those. I know you already know that, but like just it's beyond transactional, I think is really where we're headed. Okay. All right, so measurement and outcomes. So I know a lot of organizations do like their annual report, your ROI. Ask your nonprofit partners to give you one. If it's a good nonprofit partner, they're going to give you one every year. We produce them for our high level and our low level. We will give you like your numbers and your participants and how many lives we touched and what we use the money for and all kinds of things. And then you guys can use that obviously in the annual reports and the feedback that you're giving to your employees. But do ask your partners for that information. They should be giving it to you. Okay, I wouldn't be American Cancer if I didn't give you a couple of tools and resources. There's whole corporate relations toolkits that exist out on cancer.org as our basic entry point. So I would love if you're interested to sign up for the employer toolkits. That is where you're going to get those like monthly turnkey information for newsletters. You're going to get all the pretty graphics. You get everything you need to like carry it off and put them out in your plants, whatever you're doing. Educational content, this encouraging screening, all of those things. And also I did give you resources for people facing cancer diagnosis, because inevitably what happens is I meet with somebody and then you go home and somebody says, oh my gosh, Aunt Matilda just got diagnosed. We have some resources. So do make one of the first phone calls if someone is diagnosed to American Cancer. There's so many resources, I can't even tell you. Like rides to treatment, navigating health plans, navigating into clinical trials. There are so many pieces. That's another talk that I do. If you need me to come to your organization and talk about it, I'd be happy to. So I had to give you a few resources. In closing, and I'll be around for questions and everything at the end here too. So I hope that you were able to, and it sounds like some of you already have started to put it together. I hope that you were able to look beyond the relationship as just a transactional relationship and really expand it and think about like the needs of your employee community, and then how do we support them best as HR, but how do we influence it and put our arms around this entire relationship and create like a global good, a community good, an employee good, and your company can get some good kudos for it as well. So lastly, I do have a little survey. If there was other topics that you would love to hear from a charity partner, I'd love to know what those are so we can continue this dialogue. So thank you guys so much. I'll be up here for questions if anybody would like. You're closing us.